as I've looked at advertising in the dental industry for 15 years now, a lot of companies focus on ads. Okay. They have a marketing product. They say whatever about it, but the core of it is Google ads, search ads, display advertising. It's basically somebody who understands how to use the Google platform and they can kick off a marketing campaign. Okay. And when you run ads, you get a pretty quick return. If you don't get a quick return, it's not working, because the ad, you create them today, you put them online, and you start getting clicks and calls tomorrow. That's kind of how it works. Okay. So I think there is a consensus that marketing works like that across the board. So when you talk to a dentist, they're calling you at 11:59 on the day they needed a new patient, and they're like, I need new patients. And what they're asking for, they don't know it, is they're asking for Google ads or some kind of an advertising platform that quickly produces results. And they do, but they cost 5 times as much as any other type of marketing effort. The ads are so expensive, right? And they're getting more expensive now because of AI. So what you have to do is you have to get on a call with a doctor when they're like, I need patients yesterday. And I want to do search engine optimization. And SEO takes, I don't know, months, years.
Right. 6-9 months to build a foundation.
To build a foundation, it's a solid year.